So we finished treating him, and the lower part of the pubic bones is now symmetrical. Let's have you lie on your stomach. So I'm on the lower 4 inches. I'm at the bottom of his sit bone, and so, you know, the lower third of his pelvis is a fairly flat part of the ischium, and I'm taking the slack up, and I'm springing it, and I see movement happening through his whole lower extremity. So now that force is translating through the pubic joint and through the SI joint into the hip, knee, and ankle. Before that was blocked. It no longer appears to be posterior, and we had hypertonicity of the sacrospinous ligament, and now I can indent that just slightly. Okay? I can now load and spring the ischium. I can also load and spring the right ischium, and then going to the left, we have much more pelvic movement. And same thing on this side. The tailbone is now symmetrical. Now, as I predicted, we have improved movement, but in terms of trying to get your shorts to match the crease of your bottom, okay? The symmetry is improved, okay? There's only like a half of a thumb width difference now. I'm going to look at the height of the shelf of the posterior shelf of the ilium, and this one is lower by perhaps 1/4 inch. But you have movement in all directions. Okay, so that is a developmental problem. That's how you find out. You restore the movement in all directions, and then you look at alignment. Okay, and that translates to what we do in sitting, which I'll demonstrate in a short while. I also had him prone up on 3 pillows under his chest and 1 under his ankles, and all I did was push on the sacrum for 3 minutes. And now I'm able to take up the slack, and now I can spring and get some recoil of the sacrum, and then I come up to L5. I can now take up the slack, and I can spring L5, and it has spring mobility, spring forward and recoil. And that's a normal physiological property of joints, and I am so biased for doing those tests, and I so much don't understand why most clinicians don't utilize those tests, because it's a very important functional property of joints. There's even nerves in those ligaments that can inhibit muscle function when the ligaments are tight. So anyway, restoring that physiological property of spring and recoil is important. And you took a walk down the hall, and you reported that your back felt freer.
Yes.
Okay. Anything else?
It just felt more comfortable, like the motion felt more fluid, is the best way I could describe it.
And did you feel any difference in the hips?
A little bit.
Okay.
You know, I sort of have a consistent sort of either guarding or bit of discomfort in all those areas. And
you have much more intra-rotation on the right. You're now equal to the left. So we gained motion on that right hip.
Hey, that's good.
You were saying, I interrupted you.
Oh, no, I was going to say, I just felt like I was moving a little better, sort of both in the hips and throughout the pelvis.
Nice, nice. And that should stay.
Right.
Okay, I will teach you some extension for the sacrum to keep the sacrum forward bending normally when you backward bend your spine.
Yeah.
And what I'll have you back up to a table. So the back of your thigh will go against the table edge.
Yeah.
And that blocks hip extension. And then you focus more. It better isolates lower lumbar extension. I'll have you do 30 a day.
Okay.
Okay?
Okay.
And we talked about how this pelvic asymmetry that is developmental,
Yeah.
how that translates to sitting.
Right.
But before I have you sit, lay on your back, please.
Okay.
And you're more prominent on the right ASIS. I can still get lateral spring, posterolateral spring, so that's not a movement disorder. Okay, I can spring the other ilium anteromedially, so it's not a movement dysfunction. It's developmental. Okay, and if I come underneath, I can see that your right shelf is lower. Okay, but in the presence of normal spring mobility, there's nothing to treat.
Okay.
That's developmental. Okay, so that translates to when you sit, and go ahead and come sit in the chair.
Okay.
So what happens is now you're sitting on a symmetrical surface, but your factory setting is asymmetrical.
Yeah.
Okay, now most clients who have asymmetry, this tibia is shorter when I compare sides, and the left femur is longer. And that is either a function of the hips and the pelvis, or a function of the pelvis alone. Okay? And most of the times this foam placed under the trochanter makes a big difference. Okay? A lot of people find greater comfort for that. But we did the experiment, and then we had you sit on a tablet of paper that's 1/4 of an inch. Okay? And you found... Tell us what you feel when you sit on that pad of paper under the right sit bone.
Yeah, it feels more comfortable, actually more symmetrical.
Nice.
Whereas before I felt that I was favoring sort of sitting on the left-hand side. Now it feels more even.
Yeah, in the
across
long
the
term
two.
you felt like your pelvis was a little wonky when you sit. Am I correct?
Yes, long term I felt like I was sitting towards the left side as I was sitting.
Yeah. So the solution, I really favor this black craft foam, and this is from Joann's craft store. Michael's has it, Hobby Lobby has it. You can also buy 1/4 inch cork at the hardware store. The problem with cork is it dries up and then it flakes. You would have to cut the cork and put it inside a plastic sleeve, to get it to last longer. But this craft foam comes in a 5mm density, and that's close to 1/4 of an inch.
Yeah.
6mm is 1/4 of an inch. And this is called Creatology foam sheet. And so you could buy one of these and you could cut it in half or even cut it in quarters. Have 2 for your car, 1 that you carry into the restaurant.
Yeah.
Okay. 1 for your desk at home and 1 for your desk at work.
Yeah.
So I think that this will make a big difference for you.
Yeah.
The other experiment you can do is take that out, hand it to me, and now I put it under your foot. Lift the foot up. Which one do you prefer? Under the buttock or under the shoe? Under the foot?
It's hard to say. Let me try to... I think I prefer sitting on
Nice.
it.
Excellent. Good.
Yeah.
Good. All right. Beautiful. And when you're supine or standing, your leg lengths are equal. So you don't need a heel lift.
Right.
Okay? Some people need a sitting heel lift, and I do. I'm much more comfortable when I sit, and I have a 1/4 inch raise on the left side. So under my desk, I have that plastic chair floor piece. What do you call it?
Yeah, I don't know.
A carpet protector. A carpet
Yeah.
protector? Okay. So I have that, and I have the cork underneath it. And in my truck, under the carpet, I have cork underneath that, covered with duct tape so it will never break down.
Right.
Yeah. So some people benefit from a sitting heel lift.
Yeah.
Some people benefit from that trochanter roll.
Yeah.
And you benefit from a 1/4 inch under the right sit bone.
Yeah, I think that's right.
Nice. Now, I mentioned that your body compensated with right side bending of the occiput. And I predicted that that would just disappear because it's driven by a reflex. Let's have you lay with your head up here.
Okay.
And let's see if that's still present.
Okay. here.
So I put my index finger under the mastoid, and it looks more symmetrical. The tone of the musculature is symmetrical, and I can side bend it freely. Now the other test that I did with you, do you recall I had your neck extended?
Yes.
Let's come with your head up on this side of the table.
Yep.
And I'm going to point the camera to the head only.
Okay.
So your identity is preserved.
Oh, okay.
Okay? We're not putting your face on YouTube, but if you'll let me put the rest of the video, I'd be grateful.
Sure.
Okay. Yeah. So we tested you in extension. And I noted that when your head was in neutral, I noted that you had increased tone in the upper cervical musculature. And you had normal spring mobility of the upper cervical spine. The two joints of the upper spine are just below the earlobe, just below the mastoid. The rest of the facet joints are in the back of the neck. So if you want to test traction of the upper joints, you've got to have your contact in front of the ear on the head. Okay? So I put the palms of my hand on your temple area, temporoparietal. Mm-hmm. And now I'm able to take up the slack. Mm-hmm. And now I'm able to spring. And the spring translates through your whole body. I see your feet moving. So this was a reflex driven by the fact that your sacrum was stuck in forward bending. Mm-hmm. Had I tried to treat this, I don't think it would have worked. Because this was Mother Nature doing her thing. This was your body's reflex, and then I can't override reflexes.
Right.
Okay? So sometimes the first clue, supposing I was treating you for headaches and I found that restriction and I worked on it, but it never stayed improved, mm-hmm. Okay, maybe transiently improved, but never stayed that way, then at some point I would realize, hey, I'm in the wrong place. Mm-hmm. I need to find a cause for this. And the sacrum being stuck forward was the cause of this restriction. So by treating the sacrum, your upper cervical is now much freer.
Yeah, that's great.
So, interesting case study. Thank you for being willing to let me share this on YouTube.
Sure.
And we're done for today. I'll teach you stretches to address the lower windswept pelvis. And I have another video that shows that. You can... I'll point it to you. It's under YouTube, searching Hesch, my last name, H-E-S like Sam, C-H, and then lower windswept pelvis self-treatment.
Yeah.
Okay? There's another one on treatment where the therapist does the treatment.
Right.
All right? The pube will not rotate again. You don't need to do that part of the treatment.
Okay.
That's why we don't show it. And the coccyx will stay straightened out. We don't show that one specifically with that pattern. We have we show it separately on the coccyx alone, but that's not going to recur, so you don't have to worry about the side bent coccyx pattern.
Great.
That was just pulled by soft tissue.
Great.
So you're going to be a very straightforward case. I'll only need to see you twice as far as I can tell.
Okay.
And it's been, how long have you had this SI area pain?
I'd say two years plus.
Yeah.
Maybe more like 3.
Yes. And you've had the therapist that treated your hip do a little bit with your SI, but not much, right?
Correct.
And you did have an SI injection, but that was not fruitful?
It seemed to help, but it wasn't obvious. It helped a little bit.
Yeah. Alrighty. Well, again, thanks very much.